at Federal Neuropsychiatric Hospital, Uselu, and the University of Benin Teaching Hospital, UBTH, Ugbawa. Relatives of patients helplessly placed up and down while nurses were at their duty post. Many patients have been discharged. Others in critical conditions were referred to private hospitals. Resident doctors who bear the bulk of responsibility to cater for the patients are no longer at work. Though consultants were attending to few cases, the services are quite inadequate. Relatives of some patients said the strike is biting too hard on them.
If the strike, we the people fighting for health, we are going to suffer more. It's good the federal government to pay the people so that we can get our health in time.
I will appeal to the government, arrange with the doctors, arrange with them so that the doctors will be doing fine, because I think they are not paying them well.
We are appealing to them that so that they will start work. When they are working, our patient that is here, they will treat them. So I appeal to them so that they will pay. The government should pay them and they should work through their.
The president of AROD, UBTH, Dr. Ofuani Ifeanyi, and his colleague at the Federal Neuropsychiatric Hospital, Dr. Chiwomba Obuneme, said the doctors have been coping with too many challenges they could no longer shoulder.
We have interns in various centers who have, we call them house officers, who have not been paid for about 4 months. Okay, now these are young doctors who just finished school. Most of them don't have savings. Most of them are the breadwinners of their families, and then they are not being paid, so they can't afford the basic amenities that their salaries are supposed to provide for them.
We have members of the Nigerian Association of Resident Doctors. They have not been paid for 3-4 months. We have house officers. We have members of our association who are on the Give Me platform. It's a platform aside from the IPPIS. And these persons have not been paid for 3-4 months. And everyone expects them to just keep working hungry. That's unfair. That's unfortunate. And nobody likes to be on strike, but we just have to.
The National Association of Resident Doctors on the 1st of April commenced an indefinite strike following inability of government to meet terms contained in an earlier agreement. Wellington Hakodeja reporting.